Good afternoon, everyone, and welcome to today's webinar. Sherry did mention CEs, so for today's presentation, please make sure you registered for this webinar, and if so, requested CEs. As Sherry indicated, these certificates will be emailed to you in approximately 3 weeks. Please note that you must attend for the full hour in order to be eligible for CEs. And for today's webinar, we are providing a full hour of credit only. Let's get started. So this is our agenda for today. We're going to discuss the learner objectives for the webinar, why it is important that we identify behavioral strengths and needs. We're going to elaborate on the process of screening. We're going to talk about some options for tools that can be used for screening process. And of course, we're going to end with the Q&A. Now, my name, as Sherry indicated, is Dr. Daniella Maglione, and I'm the Senior Assessment Consultant for New York. And with me today is my wonderful colleague, Chris Huzinec, who is a National Senior Clinical Consultant with Pearson. Now,
good afternoon, everybody.
Thank you, Chris. At this time, I'd like to point out that Chris and I are both employees of NCS Pearson, who is the continuing education provider for the webinar. All right, so for learning objectives, we have 3 of them. The first is that we want participants to identify best practices in universal screening of student behavior. We also want participants to be able to apply the screening process to identify students' well-being competencies, as well as their behavioral areas of needs. And then last but not least, we want to make sure that participants are able to analyze the results from universal screening and use this information to guide instruction and support for all students. So I will be kicking off the presentation today, and then I'm going to hand it over to my colleague Chris halfway through. And at the end, as I indicated, we're going to answer any questions that you might have in the Q&A. So let's begin by examining the identification of behavioral strengths and needs and understanding why it is an essential first step in the screening process. So when we talk about well-being, note that well-being is a wellspring of positive psychology. In his APA address in 1998, Dr. Martin Siegelman remarked, "Let us build on what is right, not just fix what is wrong." So positive psychology focuses on the emphasis on positive emotions and the flourishing of the individual as a whole, along with the idea that every individual is born with personal strengths and potential. Now, according to positive psychology, well-being and other factors need to be examined in terms of how well an individual is functioning. By doing so, well-being can be more successfully measured and meaningfully operationalized, especially when it comes to fostering well-being or optional functioning in children and adolescents. So let's begin by examining the NASP practice model. So the NASP 2020 Professional Standards Model for Comprehensive and Integrated School Psychological Services was created to help school psychologists and other educators set goals and assist with decision-making while at the same time considering ecological factors such as the classroom, the family, and the community characteristics that impact student performance. The relevant domains that we will be reviewing today include domains 1, database decision making, domain 5, school-wide practices to promote learning, and last but not least, domain 8, equitable practices for diverse student populations. Now for domain 1, database decision making, let's talk about this a little bit. Now, some of the examples of professional practices associated with this domain include efforts that school psychologists make in collaborating with other members of the interdisciplinary team to conduct assessments and determine student needs for services. This, of course, includes eligibility for special education and to provide information relevant to the development of individual service plans. So many of you are familiar, who work with school psychologists, are familiar with this particular role. But also included in this domain is the collection and analyzing of data from multiple sources, for example, parents, guardians, teachers, and students, and different levels, such as individual, group, and system levels, to understand student needs and select and implement evidence-based instructional and mental health and behavioral interventions and supports. And last but not least, it also includes providing support to classroom teachers, to school staff, to other stakeholders in collecting and analyzing and interpreting universal screening and progress monitoring data to inform decision-making about the instructional, behavioral, and social emotional needs of students. Now let's take a look at domain 5, which includes school-wide practices to promote learning. Now in this domain, school psychologists assist in conducting needs assessments to help school-wide programs based on the needs, of course, of that learning community. In addition, school psychologists work with others to develop and maintain positive school climates and learning environments that support resilience and academic growth, promote high rates of academic engagement and attendance, and reduce negative influences on learning and behavior. And then last but not least, school psychologists also participate in designing and implementing universal screening procedures to identify the need for additional academic or behavioral support services, as well as progress monitoring systems to promote successful learning and well-being. Now, the last domain, domain 8, equitable practices for a diverse student population. This includes implementing evidence-based strategies to enhance services in both general and special education, as well to address potential influences related to diversity. As you all know, the population in the US has become more diverse year after year. Recognizing that equitable practices for diverse student populations, respect for diversity in development and learning, and advocacy for social justice are obviously foundational for this effective service delivery model. Now, while equality ensures that all children have the same access to the general and educational opportunities, equity refers to ensuring that each student receives what they need to benefit from these opportunities. So, school psychologists need to apply their understanding of the influence of culture, of background, of individual learner characteristics when designing and implementing interventions to achieve optimal learning and behavioral outcomes. And they're going to do this by considering individual differences, by looking at strengths, backgrounds, talents, needs in the design, implementation, and evaluation of services in order to improve learning and mental health and behavioral outcomes for children in family, school, and community settings. So why would we want to screen for behavior? And to be quite honest, screening for behavior is not something new. It's been around for several decades now. Well, it really helps to identify social, behavioral strengths and needs. This data might also support observations and anecdotal information that is provided by other educators. And of course, this helps to identify students who struggle with internalizing behaviors. Internalizing behaviors are things like anxiety and depression. Oftentimes, there's not an outward expression of these concerns, and as such, they tend to go unnoticed by staff. So in addition, the screening for behavior helps to take the temperature of the class, of the grade, of the school, to help facilitate interventions at the appropriate level. Now, this is Chris's most favorite cartoon here. And you'll notice that while teachers are they're excellent observers of behaviors, with the number of behaviors that occur in the classroom on a daily basis, as you can see on the slide, it can sometimes be difficult to formulate an accurate measure of the real challenges and needs if we solely rely on anecdotal gut reactions. It can also be sometimes a challenge to figure out where to even start, because there's so many different variations in the types of behaviors that are occurring. So universal screeners allow teachers to focus their observational skills and to quickly and effectively rate their students' behaviors. Now, best practice dictates that screening should be accurate, should provide valid and reliable information for decision-making. These screenings should also be cost-effective so that they can be used often, because you want to make sure that you re-administer them. And it must be an acceptable method that is adopted by professionals and, as I indicated, used repeatedly over time. In addition, as indicated on the slide, these screeners should include internalizing and externalizing behaviors, as well as social emotional well-being and competencies. Now, the impracticality of some screening measures has largely contributed to their lack of adoption for universal screening in both pediatric and school settings. But with regard to the practicality aspect of universal screening in schools, Glover and Albers in 2007 recommended that screening instruments be evaluated in terms of their cost, the feasibility of administration, the acceptability to multiple stakeholders, the infrastructure for collecting and interpreting screening data, the appropriateness of use for the entire school population, and the utility of the information obtained to provide improved prevention, intervention, and treatment decisions. Now, Randy Camphouse, who is the author of the BASC, in 2012 also indicated that the cost should include the training of staff in the use of the measure, as well as the coordination efforts involved in the analysis portion of the evaluation, as well as the dissemination of results. Okay, according to O'Connell in 2009, BER, B-E-R, is an acronym that is used to define early symptoms of disorders that eventually result in special education placement or mental health classification, diagnosis, or treatment. Now, once again, according to Camphouse in 2012, one of the goals of screening should be to identify students that are exposed to risks or are experiencing early symptoms that increase the potential that they will have negative emotional or behavioral outcomes, so that we can obviously take action prior to a diagnosis occurring. Now, according to Camphouse, a BER screener should include questions from 4 different domains: externalizing, internalizing, attention, and adaptive behaviors. Now, the acronym BEAR itself refers to behavior and emotional risk. And as a category, you can see that this includes not just maladaptive behaviors, but emotional issues and thought patterns, and obviously the delayed acquisition of those pro-social coping skills. So as you can see, BEAR is a precursor to the development of mental health disorders, which ultimately contribute to academic problems. Now, in their article, Promoting Student Resilience in School Contexts, Morrison and Allen outline specific actions that school personnel can take to promote healthy social and emotional development of students at the school level. These actions or recommendations are conceptually grounded in risk and resilience theory. And as such, it recognizes that environments, as well as individuals, possess risk and protective factors. For example, having a nurturing relationship with an adult is a protective factor, as opposed to a student who does not have a nurturing relationship with an adult. This would be a risk factor. It's also important to evaluate students in terms of these characteristics to include not just risk level, but of course their strengths. Now, DiPerna and Elliott in the year 2000 defined academic enablers as attitudes and behaviors that facilitate students' participation in and benefit from academic instruction in the classroom. Measures of school climate, broadband measures of social, emotional and behavioral functioning, social emotional learning, and motivation can be used to identify strengths in areas of needs as academic enablers in students. For example, if children and adolescents with high symptoms of depression, those students are more likely than their peers to have academic difficulties. In addition to that, though, those children are also more likely to smoke cigarettes, to abuse alcohol or other drugs, and of course, to attempt suicide. So let's review the screening process in a little bit more detail. So NASP has general guidelines for universal screening that are included on their website, and I encourage you to check it out at nasponline.org. Now, universal screening, as I indicated, is a proactive approach of using brief and efficient measures to identify students that are at risk for future difficulties. The data is then used to help connect children with much needed services and supports. So schools are a great place, right? An ideal setting for identifying students at risk due to, number one, the large number of youth in the schools, the ability to provide follow-up care without some of the traditional barriers to accessing care in the community, like, for example, cost, insurance, and transportation. Brune, Woodgroves, and Huddle in 2014 conducted research that indicated that currently only 1 in 8 schools have adopted universal screening procedures. And I'll say that again, only 1 in 8, and that was in the year 2014. In the research, you might also find that some schools choose passive consent. So this is where consent is implied unless a caregiver actively opts out. And one of the criticisms of passive consent involves its use in communities with high populations of illiteracy or non-English speaking families. So maybe something to think about there. And the first thing that we need to do is make sure that we're following the prescribed plan for screening with fidelity, right? That's super important, as well as having a clear outline and established goal in place. Obviously, universal screening practices require buy-in, not just from the educators, but also from the families and the community. As we previously indicated, we need to include risk factors as well as social emotional strengths. It is important that the information that is obtained not be used for diagnostic purposes. Thus, we're screening to better monitor student needs and then plan for intervention. And as with all plans, educators need to establish a clearly defined blueprint to meet in order to analyze the data, revisit the interventions, and then consider staff allocation for resources or services. So we need screeners that monitor students' mental health, that target individuals and informants, right, like teachers, parents, self-report, that can be used in conjunction with other data, that assumes a clearly defined population, such as, for example, a specific grade in a school or all the students in a given school, and also used within the framework of behavioral support. Additionally, schools should consider the time and, as I indicated, the expertise required to analyze and interpret any findings. Interpreting interview data while providing more in-depth information can obviously require significant effort. Now, we also need a screening process that informs continuous problem solving for improved outcomes across a continuum of supports, and that identifies students who may benefit from intervention, that uses instruments that are well standardized and normed, and this is super important, and we're going to talk about this in the next upcoming slides, but that are also aligned with the vision, the mission, and the priorities of school mental health supportive efforts, and that are included in efforts to provide feedback to all stakeholders. So let's review now some of the assessment tools that are available for screening process through NCS Pearson. Now, multimodal screening efforts are important because they provide input from different perspectives, right? These may include teacher observations, teacher nominations, structured observations. For example, the BASC SOS is a wonderful one, it's my favorite. Formative evaluations, surveys, broadband behavioral measures, and narrowband behavioral measures. So when I talk about broadband, I'm referring to something like the BASC-3. That is a broadband behavioral measure. While for example, the Beck Youth Inventory, or BYI-2, is an example of a narrowband measure. Now, at Pearson, we use the same model. This is where the first step is to screen universally, and this includes all students to discover strengths and areas of need. And then to further describe the needs of students, we use more comprehensive assessments. The information is then gathered from screening and assessment, and this can be used to guide and prioritize interventions and supports. Then after intervention, screening or assessments can be used to progress monitor, to track the student improvement, and to judge the effectiveness of the intervention. Now, the BASC-3, many of you are familiar with this system. It is a comprehensive set of rating scales and forms that include the TRS, the teacher rating scale, parent rating scale, self-report of personality, student observation system, which I indicated earlier, and I indicated it was my favorite, the structured developmental history, and the parent relationship questionnaire, all of which allow you to conduct a targeted assessment for specific situations using complementary components. Now, this BASC family also includes the BESS, which stands for the Behavioral and Emotional Screening System, which is used to efficiently and systematically screen classrooms and other large group settings for students at risk for developing behavioral and emotional problems. The revised behavior intervention guide, we refer to that as the big manual, which provides comprehensive and practical information on targeted interventions for behavior and emotional issues. The behavioral and emotional skill building guide, which is a new group-based skill training program for use by counselors, school psychologists, and others at the tier 2 level. And then last but not least, the Flex Monitor, which you'll see in the last column, and this is used as a progress monitoring tool. Now here's an example, or here's some more information about this BASC-BESS. As you can see, it is for students ages 3 to 18. It consists of only 28 items, so it's fairly quick to give. It's used to quickly and efficiently assess this behavioral and emotional risk and overall mental health status. And I'd like to let you know that it is available in Spanish for the parent as well as the student. So it's not available in Spanish for the teacher, just for the student and the parent. But obviously, this is something that you'd want to use at the tier 1 level. Now, the student form of the BASC-BESS allows the student to impart their own perception of their social, emotional, and behavioral strengths and areas of need through these following indexes. So you'll see the internalizing risk index, which includes internalizing behaviors such as anxiety, social stress, depression. You'll see the self-regulation index, which consists of items associated with self-control, issues from the hyperactivity and attention problem scale. And then you'll see this personal adjustment risk index, which consists of items associated with relations with parents, interpersonal relations, self-esteem, and self-reliance on the BASC SRP. So these skills assess characteristics that obviously are important for establishing good relationships with others, as well as determining a healthy view of oneself. Let's take a look at the next slide here. So you'll see that the BESS also has teacher and parent forms. And this is a way to provide important people in a student's life and allow them to give their perceptions through those same indexes. Once again, the externalizing index, the internalizing index, and then this adaptive skills index. In any discussion that we have about students' well-being, it's obviously important to include input from both the home and the school so that we can look at issues that pose as risk factors for the development of mental health issues. But it's just as important to include the students' adaptive skills. So knowing these strengths can help guide supports that can be used to address social, emotional, and behavioral challenges. All right. Now, this is an example of the BESS individual report on Review 360. As you can see, just like the BESS grading scales, the BESS includes validity indexes. And you'll see an F index, you'll see a response pattern index, as well as a consistency index. In addition, it provides a behavioral and emotional risk index, and it'll give you the raw score, the T-score, the percentile rank, and then the classification level. In other words, is a student at normal risk, elevated risk, or extremely elevated risk? And then underneath, you'll see the sub-index score classifications, right? Externalizing risk index, internalizing risk index, and adaptive skills risk index. So here, and this is a screenshot from Review 360, and this is an integrated report from the BESS. You'll notice that on the left-hand side, the students are categorized by risk level pending results obtained from the BESS behavior and emotional risk index. So the students can be examined in this group report by either ethnicity, by gender, by grade, or by even specific teacher. Now I'm going to hand it over to my colleague Chris to further examine and dive a little bit more into Review 360 in the next upcoming slides. So Chris, take it away.
Thank you, Daniella. Review 360 is a platform and behavioral support system. As a platform, we use it to administer several of our behavioral and social emotional learning screeners. So we'll be talking about it a little bit during this presentation as we address those. What Review 360 allows for is the group administration of many of these screeners, and then to link the results from these screeners specifically to interventions that are available not only on Review 360, but then some of our BESS 3 interventions as well. Okay, this slide is an example of a teacher report. And again, as Daniella had pointed out, there are different group reports that we can generate using Review 360 from the BESS results. In this report, we can see that we have our students' performance, and it's color-coded in red, green, and yellow, with red being severe to being at risk, yellow indicating some at-risk problems, and then green normalized behavior. So when we look at this report, we can see going down a teacher's roster, which students in which composites, internalizing, externalizing, or adaptive behavior, these students are how the students are performing. Also, if we have multiple raters, we can also look at the ratings. So in the case of Brent Thomas, we have a teacher rating as well as parent rating, and we can compare the ratings between teacher and parent. This also can be done, can be used in terms of progress monitoring, in which you can compare, there's a report that will compare different administrations of the BESS. All right, on Review 360, it allows you then to dive deeper into the individual student. So if you click on an individual student's name, then you will then be able to see their individual report. And as we can see here with David, we have a student who is at risk for their overall behavioral emotional index, risk index, and for their externalizing and internalizing behavior, but not is exhibiting normal behavior in their adaptive risk index. We can then, if we want more information from this report, we can click on, if you look at the blue arrow, we can click on full report. And what full report will do is will give us item analysis as well, so that we can see how the student responded to each of the items. Then, as we see with this student, since the student is at risk, if we follow the red arrow in Review 360, we can move from the best results to a process that will allow us to set up a behavior plan to support the student. So by clicking on Create Plan, we're able to move to the plan creation function of Review 360 and use the information from the BESS to set up a behavior plan. And we'll talk more about that when we talk about interventions and supports. All right, in this next section, though, we'll be talking about screening for social emotional learning. So Daniella very thoroughly talked about why and how we can screen for behavioral issues and how we can screen to identify mental health challenges using more broadband behavioral screening and assessments like the BESS. Now what we want to talk about is how we can proactively look at students' strengths in terms of their social emotional learning. And if we're talking about social emotional learning, I'm sure almost all of you are familiar with CASEL. CASEL is kind of a what works clearinghouse for social emotional learning. It provides research, guidelines, frameworks, evaluations of effective research-based programs, also evaluations of effective assessments, and assessments and screeners. So you can go to their website to find out information that can help you in selecting different screeners. Later in this presentation and in this handout, in the resources section, we do have a link to CASEL's website and their assessment guide. What CASEL also has done is it kind of has codified how we approach social emotional learning. We are now looking at social emotional learning in terms of the 5 social emotional learning competencies that CASEL has identified. Oh, yeah, sorry. Okay, thanks, Daniella. So these are the 5 social emotional learning competencies that have been identified by CASEL. They're social awareness, self-management, self-awareness, relationship skills, and responsible decision-making. Social self-awareness is the ability to accurately recognize one's emotions and thoughts and their influence on behavior. Self-management is the ability to regulate one's emotions. Social awareness is the ability to take the perspective and empathize with others, even if they're from diverse backgrounds or from cultures different than our own, and to understand social and ethical norms of behavior. And relationship skills is the ability to establish and maintain healthy and rewarding relationships with diverse individuals and groups. And then the final one is responsible decision-making, and that's the ability to constructively and respectfully make choices about personal behavior and social interactions based on considerations of ethical standards, safety concerns, social norms, and the realistic evaluation of consequences of our various actions and the well-being of ourselves and others. What I did real quick, Daniella, if you can go back 2 slides. Sorry, one more. All right, what I didn't talk about is in expanding their definition, CASEL did talk about their 5 different competencies and how they can be applied not only in the school and classroom, but the importance of doing this in concert and cooperation with families and caregivers and the community, and especially focusing on equitable practices, social justice, inclusion, and inclusion. So, recently they have made great efforts to make sure that all of our students are included in the efforts of improving and social emotional learning, and taking advantage of all of our students' different strengths in those areas, and then providing our students with supports when they have areas of need. All right. Okay. So for the here at Pearson, we use the SSIS SEL as our social emotional learning screener and progress monitoring scale. So that's a tool we're familiar with. There's a lot of different tools. I'm glad to say that ours is considered an evidence-based tool by CASEL. And again, there are other ones. And if you go to that CASEL guide and you put in your needs, you can find it may not be the SSIS, it may be another measure, but you can find the measure at their assessment guide website that most meets your needs. But in this presentation, since we want to talk about the things that we work with, we're going to talk about screening for social emotional strengths and competencies by using the SSIS SEL screening progress monitoring tool. Okay, it screens in 8 different areas, including the 5 CASEL competencies. It also screens students on 3 key related academic competencies. It can be used with students between the ages of 3 and 18 who are in grades pre-K through 12. There are 2 methods that we can use the screening progress monitoring. We can use it in screening. And when we use it in screening, again, it's suggested often at Tier 1 to do screening universally, but you can also use the screening as targeted screening if you have students who have already been identified by teachers. But again, since we're working with trying to support student well-being and develop their areas of strengths, it is very much recommended that we screen all students. Then the second method is progress monitoring. We can use this screening progress monitoring tool to monitor progress over time through multiple administrations. And what we can also do is we can use this in concert with our interventions or our social emotional learning curriculum in order to determine if that curriculum is effective overall, if we're looking at a group of students, but then also for those identifying those individual students who may not be responding to instruction. And we can then, within a multi-tiered framework, use further assessment maybe to identify more particularly their areas of need for social emotional learning. The user qualification for the SSIS SEL is for teachers or those who have a similar role. The SSIS SEL uses a 5-point proficiency rubric in order to assess each of those CASEL areas, each of those CASEL competencies. 3 of the levels, 3 through 5, are levels of proficiency. And then level 2 is emerging or at risk skill level. And then level 1 indicates a limited skill level. And again, in the system, and this is also on Review 360 as a platform, it is color coded for red and yellow being more at risk performance, and then green being higher levels of proficiency. All right, so then when we look at, after we screen the student, and this is on Review 360, we'll have a report for the student that we can look at. Again, similar to what Daniella mentioned about using the BESS on Review 360. Review 360 also allows for group analysis of students, like by the classroom level, by the grade level, by student groups. So we can do that analysis as well. But right here, we're looking at an individual student, and we have an individual student who has is at risk overall for their SEL competency, and then also either at risk or just emerging for each of the CASEL 5 CASEL competencies. And particularly, we see that they're at risk for self-awareness and relationship skills, where those are the areas that they probably require if we prioritize, requires support. And within the report, it defines relationship skills and then indicates what low scores might indicate in that competency. And if you notice at the bottom here, the CIP stands for Classwide Intervention Program, which is the SSIS SEL's SEL curriculum, or their intervention program. And they have 30 different units, 10 core units, plus 20 advanced units that can be used to support students in the development of social emotional learning skills. We're going to talk more about those when we talk about social emotional learning interventions. But in the next section, I'm going to talk about behavioral and mental health interventions. And these are interventions that we can use in response or in alignment with and through guidance from screening of mental health screening and behavioral and mental health screening, that we use broadband measures like the BESS as a screener, or the BASC if we're using a behavioral assessment. All right. As I had mentioned before, when we're using the BESS in Review 360, we can use the information from the BESS to then select select different interventions and supports. We can use this straight just from the results of the BESS, and we can use our specific the interventions that we may already be using in the classroom. But Review 360 does have a process that helps us in selecting the most appropriate interventions and supports. But we start again with the identification, and the identification is done through universal screening like the BESS. So we can use the BESS to identify those areas that the student needs support. If it's anxiety or if it's externalizing behavioral issues, we can identify that. If it's aggression, once we identify that, we can then use that information in concordance with other information that we may have. We may have done a functional behavioral assessment of the student as well. We may have teacher observations. We may have a narrow band screen or assessment that we would use. We would collect all of that information to help us identify the problem behaviors or the behaviors that we want to most help the student address. And so therefore, we're able to, from that, identify some and select some objectives or behavioral objectives that we can put into a plan. Now, in the selection process, we also want to select objectives based on a specific problem behavior. But then along with that problem behavior, we want to identify a positive replacement behavior. And this system will allow us and help or guide us in that process. And then finally, what it does is it helps us identify some interventions that we can use and implement to support the student. All right. Okay. So for example, if we have a student who scores on the BESS that shows that they are having challenges with defiance and that they're being defiant with teachers or other adults, we can identify that using our information from the BESS, and then we can further dig down and identify that based on the item analysis that that student doesn't follow directions during activities, so that we can then identify a replacement behavior like follows all oral and written directions and use that in their behavior plan. So again, what we're able to do is to create a behavior plan based on the results from the BESS and other information we may have collected about the student by identifying the issue, and in this case, defiance, that they're being challenged with, and then use it to develop a behavior plan that we can use first to support the student through strategies and intervention, and then also monitor the student over time to see if our interventions are working. And with interventions in mind, that's what Review 360 does on the next step. After we have identified the problem behavior and the replacement positive behavior, we then can select appropriate strategies that will support improving the student's behavior in the area of defiance. And two of those is compliance training and limit setting. We have a list of some of the videos that go along with these strategies in the resource section at the end of this presentation. All right, so here's an example, and here's an example of from Review 360. What it provides is a description of the training, of the strategy. It provides a step-by-step implementation process for the strategy, and then the videos that I just mentioned. It includes the videos that can be used that kind of show the teacher going through step-by-step using the strategy. All right, along with the interventions from Review 360, as we know, there are a lot of other interventions out there, a lot of research-based interventions, and one of the authors of the BASC, Dr. Kimberly Van Ness, pulled together many of these interventions as they've been used to help students address mental health challenges. She put them in her behavioral intervention guide and her skill building guide that are both available, that are both aligned with the BASC assessment tools, including the BESS. And so here's an example of some interventions that can be used to support students who are challenged with anxiety. And then in the skill building guide, they are okay, in the intervention guide, the strategies are more presented in a clinical fashion, and in the skill building guide, the same interventions and supports for anxiety, depression, and other mental health challenges are presented more for use within the classroom or teaching environment. And so here's an example of some of the strategies, modeling and exposure based treatment that are available in the skill building guide. They provide a description for the teacher, the basic steps that are used for the strategy, an illustration of how the strategy is used, and then some specific teaching strategies that the teacher can use. All right, along with information that can be used within the clinical setting in the intervention guide, the classroom setting within the skill building guide, the BASC-3 also has parent tip sheets that that teachers can share with teachers and school psychologists and other professionals can share with parents and caregivers that mirror what is being done in the school in order to support the student. Here's an example for the anxiety tip sheet. There are tip sheets for many of the common behavioral and mental health issues that our students are facing, things like attention problem, depression, hyperactivity. So we can use these to make sure that there is collaboration and coordination between our efforts at school and then in the home. All right. In the next section, I want to talk about the social emotional learning skill building. All right. Again, we can use CASEL for a starting point when we're talking about the types of skills that we want our students to develop in terms of the SEL competencies. CASEL does provide different tools like this SEL roadmap. Here's an example of the different competencies defined, and then the skills that we need to know and need to use now as we're re-emerging and re-engaging with our students. So CASEL does provide this framework that can help direct us in the types of specific skills that we can instruct our students in that reflect those competencies we want them to develop, or in the competencies that the students already are showing strength in to further develop their well-being. All right, in our system that we use, the SSIS SEL, the Classwide Intervention Program, as I had mentioned previously, has 30 social skill units that are based on the CASEL competencies or aligned with the CASEL competencies. The first 10 units are considered core skills. And then the 20 other units are considered advanced skills. And all of these skills, like I mentioned, are aligned to the CASEL core competencies. And since the screener is aligned to the CASEL core competencies, the information from the screener, like I was showing you earlier, can be used to identify those areas or those units within the Classwide intervention program that can be used to help strengthen those areas. So if we had, I believe our student had issues with, had challenges in relationships, we might want to choose Unit 7, get along with others, and prioritize that. And if we have a group of students in a classroom that was showing showing challenges in self-management and paying attention to their work, we may want to use a class-wide intervention that, like Unit 4, pay attention to your work, with all of the students. All right. So here's some examples of, and Daniella mentioned earlier, as we are working to develop the well-being of our students, we often want to focus on promoting their resiliency. And there are many SEL skills, and particularly for the SSIS SEL Classwide Intervention Program, there are skills that do enable resiliency building. Some of the skills are asking for help, expressing feelings, saying when there's a problem, being positive about our future. So you can see that here are different skills that are aligned with the specific CASEL competencies that we can use within the Classwide Intervention Program to help enable students in their development of resiliency. All right, the Classwide Intervention Program uses a 6-phase instructional process that was expanding on the 3 T's of teaching: tell what will be taught, tell what was taught, and tell how it can be used. It also builds on, and as Daniella mentioned, in identifying the academic enablers research, Dr. DePern and the author of the SSIS SEL, Dr. Steve Elliott, used a lot of information on how we can teach academic enablers in the development of the instructional process for the Classwide Intervention Program. And it involves, again, 6 steps. The first step is the tell phase, or the tell step, in which the teacher is involved in coaching and identifying and describing the skill. So if it's get along with others, the teacher will describe getting along with others, the skill steps involved with getting along with others, and the importance of getting along with others. In the next phase, the teacher will then model the skills And then the SSIS SCL Classwide Intervention Program has resources like videos and tip sheets that can be also used to do this, to show the skill in action. Then the next phase is the do phase, in which students will engage when role playing and act out the skills related to getting along with others. And then along with that, they'll follow up with more practice on getting along with others, the behavioral rehearsal step. And then the students will engage in progress monitoring to formatively think about how well they're developing that skill is developing in their activities, in their role plays that they're engaging in the classroom. And then finally, the teacher will have a guided discussion with all of the students about getting along with others, how it was done in the classroom, and now how can it be done when I move out into the school, or I'm at home, or in the community, so we can generalize those results. Some of the activities that can be used, I mentioned some of them that are used in the Classwide Intervention Program, like role playing. There are other activities, and we all have these different activities that we've used with students that we can also use when we're trying to develop social emotional learning skills with students. You can see things like partner learning and things like that. And then here, for example, is one of the SSIS SCL sample units. It is getting along with others, unit 7. And as you can see, there's a definition of that the teacher will use, and then the skill steps will be identified. And you can see also the resources that are available in the Classwide Intervention Program that can be used in the teaching of that skill. All right. And then, like I'd mentioned, we have some resources that we have used often in the production of our different webinars. There are some resources from the BESS on how to remotely screen for mental health. There's a webinar by one of the authors, Dr. Camphouse. We also have instructional videos that can be shared with students and parents in Spanish and English on how to fill out the BESS form. As I'd mentioned, also, we had the Review 360 videos for some of their strategies on the Review 360 telepractice page. And then we have resources that I'd mentioned about helping to select screeners and assessments, including the link to CASEL's website. And then finally, CASEL has a roadmap on how to re-engage with students in teaching social emotional learning that's available at their website. All right, if you would like to have any questions answered, or are interested in some of the materials that we talked about today, this is how you can find your assessment consultants.
Yes, please navigate to this page, click on K through 12 clinical assessment for schools, and we appreciate your questions. If we have not answered your questions during the webinar, please use the link here to find your assessment consultant, and they will be happy to follow up with you. Thank you for attending today's webinar. We wish you an amazing day. Take care.